But these vaccines come with side effects. Investigative reporter Brendan Kirby is standing by live at University Hospital, which will get the vaccine first in the Mobile area.
Now, Brendan, this could be harder than taking a flu shot, according to what some people are saying.
Yeah, it certainly looks that way, Byron and Shelby, and that has healthcare experts fretting over how it might impact participation. Perhaps more challenging than actually developing the coronavirus vaccine is persuading people to take it. Polls show reluctance already is high, and some folks I talk to are split. John Troe says he'll get the vaccine when it's available.
Mild side effects, or it's mild to moderate side effects, as long as there's a low side, I don't see where it would be a problem of taking it. I would be more than willing and acceptable to taking it. I'd rather take something that it would help me.
But Barja Wilson says she worries about potential side effects.
I would like to see more studies being done and just people's reactions to it before taking it.
The manufacturers have reported mild to moderate side effects in clinical trials. Those side effects include localized reactions like sore arms and more serious symptoms like headaches and fevers. The good news is that volunteers in the clinical trials have reported that they go away within a few hours. But Mobile County Health Department epidemiologist Scott Shavers tells me he worries the side effects could make it harder to get people to vaccinate.
Those are not insignificant. I mean, some of those can be headaches that are debilitating. From what I understand, after the second dose, then in some people that immune response is fairly pronounced and likely stronger than what you would see in, let's say, your traditional vaccine regimens.
But Dr. Paul Gepfert, a University of Alabama at Birmingham professor who's worked on the Johnson & Johnson vaccine trial, says the side effects are minor compared to even a mild case of COVID-19.
I think word of mouth will be interesting. When they see their friends get it and whether their friends say it was the worst experience of my life or whether they say it's not so bad. I think it's going to be the latter, that it's not so bad when it's all said and done, and most people will take it.
How all this affects participation matters because even a highly effective vaccine needs to have about 2/3 participation in order to reach that herd immunity we've all heard so much about. Reporting live in Mobile, Brendan Kirby, Fox 10 News.
All right, Brendan, thank you. All right, let's take a look at the latest COVID numbers from the State Health Department. There were nearly 2,300 new cases reported today, and that does include probable cases. Since mid-March, there have been nearly 250,000 cases total in Alabama. Hospitalizations also going up. Yesterday, the state reporting 1,600 inpatients being treated for COVID. Nearly 25,000 have been hospitalized in Alabama since March. But there's this as well, the survival rate. People under the age of 70 survive at least 99.5% of the time, and younger people are at an even lower risk.